Hello, everyone, and welcome to episode 106 of the Veterinary Behaviour Chat podcast. So today I'm actually going to talk about a topic that's very relevant to me today because I am literally just about to go and see an 18 cat household in Dubai that is obviously struggling with some behavioural presentations. And I just wanted to kind of chat a little bit about how I'm preparing for the consultation. What are the thoughts that I'm having? What are all the things that I think are going to be important? And most importantly, so in this particular case, for example, the client has highlighted, I think, 4 cats in particular that they're concerned about. We've got urination outside of the litter box. We've got some obvious inter-cat tension and aggression. And they've sort of mentioned 4 cats out of the 18 that are more sort of, I guess, overtly involved in all of this. However, when I think about an 18 cat home, I think about the fact that probably the other 14 cats are somehow affected as well. So I just want to chat through a little bit about what my approach is and how I kind of work through these things, and I give you a little bit of an outline of what a treatment approach might look like. Now, here in the UAE, I see a lot of these multi-cat household cases. It could be very, very unique to the region. I don't see many of my colleagues seeing as many cats as this, and I know that I've done, a couple of episodes before on multi-cat homes. But I think, there are a few things that I think are really important and that I really just want to highlight here. So I'm going to talk you through those. So obviously we have the 4 cats that the client is most concerned about. And I think that's really important because those are the cats that they've highlighted. So we absolutely want to address those. We want to make sure that we're kind of getting into sort of the depths of that. And understanding what the main challenges are, what the things are that the client is really concerned about, what they're struggling to live with. So I think that's really, really important. But when we look at this sort of, even just the 4 cats within the 18, it's incredibly important that we look at each individual cat as an individual. And that can sometimes be quite tricky because it sort of all can jumble into one, especially when the caregiver sort of tells the stories of what's going on. It can be difficult to understand who's doing what is each cat's individual behavioral style and temperament. So really getting deep and doing deep dives on those things is potentially really, really important. And these cats can be quite different. We can have some cats that are very confident, bold, vocal, athletic, especially here in the region. We get a lot of Arabian Mau cats. These 18 cats that I'm about to see are all rescue cats. So really, really important that we understand their sort of temperament style, also their early life experiences and their socialization period. We can get other cats that, on the other hand, are a little bit more timid and shy, that might be more the victim, in inverted commas, cat. And we want to understand what their temperament, their behavioral style is like. They're often more avoidant. They tend to be the ones that run away and hide. What is their underlying emotional state or emotional motivation versus maybe the cats that are more offensive, perhaps more forward focused, often termed the aggressors. So it's really important to understand each individual cat's temperament, behavioral style, I want to say personality. So those things are really important, and that we don't just look at them as kind of a ball of 4 cats who are just happen to be involved in this sort of behavioral presentation. Now, the other thing that's really, really important is that we hone in on each cat's physical health status. So I have another multi-cat home case, where we have 8 cats. And over time, so we've been working together for the last 3 to 4 months, and over time, we've actually identified a number of physical health presentations. So we had one cat that actually had quite severe dental disease, who was involved in some of the inter-cat aggression scenarios. So that was something that needed to be addressed. We also have another cat who ended up presenting with feline asthma, where the caregiver thought it was the cat trying to cough up hairballs or fur balls, and actually they ended up being feline asthma episodes. And as you can imagine, those things all contribute to the cat's experience of stress and maybe how they then interact with the other cats. If they're painful, such as with a little cat with the dental pain, they might be quite defensive. So all of those things I think are really important. And I want to say this takes a bit of time. It's probably not something in an initial consultation where you've got maybe a couple of hours to sort of assess the situation and get a big picture overview in these multi-cat home cases. You're probably not going to be able to identify all of the physical health challenges. We also, in this 8-cat home, we also have a couple of GI issues. So it's quite a complex situation, and you really have to address things step by step, one by one. It also really depends on what the caregiver can cope with at that time, both financially as well as, you know, from a sort of a caregiver burden load, you know, multiple trips to the veterinary clinic to get some of these things sorted out. I mean, 8 dental extractions is probably not going to be an inexpensive procedure. So bearing in mind some of those things and getting some of those things ticked off the list one by one. And, you know, as I mentioned, with that particular household, we've been working together for 3 months, and it's taken that amount of time to really get a good handle on everyone and to make some really good big inroads. So don't underestimate how much time that can take. Now, I'm really curious to see what we find with these 18 cats today. And again, I'm going to be focusing in probably for today on the 4 cats that the client is really most concerned about. And we're going to start establishing, you know, some of those behavioral presentations and diagnoses. We're going to be looking at, you know, what is going on in terms of urination outside of the litter box. Have we got urine marking? Have we got urine voiding? We're going to be looking at sort of the whole home setup as it pertains to litter boxes. Now, I saw in the questionnaire that we don't have nearly enough litter boxes for 18 cats. I think we've got maybe 4 litter boxes for 18 cats. So that's already, you know, something that we're going to be wanting to optimize. And these are some of the real basic foundational pieces that we're going to put into place. So really, really important that we go in, we look at the cats as individuals, and we take things step by step. Now, with an 18 cat home case, I'm also expecting that we're going to be onboarding these clients for a much longer term working relationship, you know, perhaps 3 months, perhaps 6 months. And I do offer packages where clients can, you know, tap into either a 3-month package or a 6-month package with myself. And I see them every couple of weeks, and we just optimize step by step by step. And also sometimes for the cats, if you make a huge number of changes all at once in one go, that can be really difficult for those cats to manage. So again, addressing things stepwise, bit by bit, tweaking here, tweaking there, optimizing here, optimizing there, is probably going to give us a better outcome in the long term. And it's going to keep reinforcing, you know, what's going on to the caregiver. I'm going to be able to continuously reiterate, you know, what is normal feline behavior? What are we working against? What are the resources that they need? What are the body language signs that they need to be looking out for? Because let's face it, that's going to be a pretty big job for a household of 18 cats. And they also have 3 dogs. I'm going to kind of not focus too much on the dogs today, but yeah, certainly understanding, you know, the core issues and getting some of the real basic environmental pieces right. Addressing the 5 pillars of a healthy feline environment. And I've got a podcast episode on that right at the beginning of this podcast. So you can go back and just have a look for the 5 pillars of a healthy feline environment so that you understand what are going to be some of the things that I'm going to be really focusing on. Now, the other thing to say is that even though we have perhaps 4, in this case, cats involved in sort of the main behavioral concern, that doesn't mean that the other cats are unaffected and fine and dandy. If you imagine living in a multi-cat home where we've got 4 cats that are maybe actively fighting and urine marking, those other 14 cats are going to be affected in some way. And they are going to be experiencing increased levels of stress as a result of some of the behaviors that are going on with those 4 cats. And it might end up being more than 4 cats, right? I'm just going off the questionnaire and the information that the caregivers sent to me. But when I get there, we might actually identify that there are a couple of other cats that are at risk and that need sort of immediate intervention and help. But certainly those cats on the fringes, on the periphery, those that maybe don't get so much involved with things, that try and avoid, that try and disperse, that try and take themselves away. I think luckily today in this case, we've got a very large home, which is great for us. The more space, the better. But those other 14 cats are for sure going to be affected in some way. And that's something that, as part of that comprehensive treatment plan, I'm also going to be addressing. So I'm going to be addressing, what can we do to reduce stress for the other cats as well? And some of that absolutely is going to be environmental management. Again, it's going to be providing more resources, especially more litter boxes for everyone, food stations, water stations, resting places, opportunities for play, making sure that we respect the cat's sense of smell. All those things are going to be so important. What are the human interactions like? What are some of the perhaps more covert or subtle sort of inter-cat tension signs? Can we identify those in some of the others? A lot of it's going to be client education and teaching the client what to look out for. So I go in and I look at the core problem, but I also absolutely evaluate what's going on with the rest of the cats. I'm saying in this case 14, it might be slightly less than 14. It could be that some of them are also part of the core problem, right? So we need to try and understand that and figure that out. But there is quite a lot we can do. And I always jokingly a little bit refer to this as herd health or herd management. So when we've got 18 cats, yes, we're treating the individual, but we're also treating the collective. And there are a number of really great options for treating, the overall group of cats. So we're definitely thinking about things like pheromones, which I really think is beneficial in cases like this. So if we're using plugins or sprays in the environment, that's going to benefit all of the 18 cats. So that's a little bit part of my herd health management piece. But also, can we use supplements such as Zilkine, for example, for everybody? And, I'll often use a larger capsule that I'll split between a number of cats. So if I'm using a 450 milligram capsule, is that something that I might be splitting between perhaps 6 cats, for example? So how can we build that in? So that's another really great sort of herd health management piece. And then finally, thinking about diet. And again, we need to go in and we need to understand, do any of the cats have specific dietary requirements in terms of veterinary prescription diets or other underlying health challenges? But can we go in with a diet such as a Royal Canin Calm diet or a Hills biome stress or CD stress, for example, that again, we can feed to the majority of the cats or many of the cats as part of that herd health management piece. So we're really looking at these cases on a number of different levels. And one of the things that I'm always a little bit concerned about is those cats that are not obviously displaying behavioral challenges. They may still be affected by the stress, and they may then display physical health challenges, whether that's feline interstitial cystitis, or whether that's perhaps over-grooming, or whether that's perhaps upper respiratory tract infections, herpes virus in particular that lies dormant for a period of time, and then in periods of prolonged stress, that comes to the surface. What about gastrointestinal issues? Do we have dysbiosis or dysregulated microbiomes because of the chronic stress that these cats may be experiencing. So I'm going to be kind of asking a lot of questions about some of those things as well. And that might not even be something that the caregiver is necessarily aware of. So, we're going to be going in and we're going to be asking about, so, do we have any other signs of other unusual behaviors that the caregivers are noticing? And then sometimes we have abnormal repetitive behaviors. And again, that might not be in the core cat group. That might be in the, I'm going to call them fringe cat group, where we maybe have pica, for example. We might have one cat that's really motivated to chew or suck either fabric items or chew on other non-food items such as rubber. That's a really classic one in cats. Rubber or plastic things. And those, again, are sometimes things that the caregiver doesn't realize as being an important behavioral presentation. But through questioning them, we're going to understand how, whether there are any cats that are at risk and that need to kind of be included in that core cat group. So those are some of my kind of initial thoughts. So treating everyone, making a distinction between the core group and the fringe group, having that herd health management piece, obviously addressing physical health for sure in the core group. But over time, we're going to be looking at physical health for everybody, making sure that we're optimizing the environment to make sure that we're providing enough resources and, that we have acceptable interactions, whether that's with humans or, optimizing social interactions between all of the cats. We might also even look at things like separating some areas of the home to give different affiliated groups of cats their own separate spaces. So understanding who is friends with who, essentially, who has positive or affiliative social relationships, who doesn't get along at all. And to understand that, I often ask the question of who grooms who. And again, that extends to the whole 18 cat group, to try and understand, well, which of the cats form a really stable social group, and can we give them somehow their own space? So yeah, lots and lots of things to consider. And then, of course, I am going to be thinking about who may need psychopharmaceutical treatment. So I'm going to be thinking about that core group. I'm going to be absolutely looking at diagnoses, because it's only with a diagnosis that I can actually really think about appropriate psychopharmacological interventions. Then we need to look at ease of administration with a big group like that. What are we going to be thinking about? The behavioral signs. So if you know me, I always look for behavioral signs as they relate to their neurotransmitters. And then I choose the appropriate psychopharmaceutical to target those neurotransmitter imbalances. So those then, of course, are going to be some of the tools that I'm going to use, particularly for the core group, but maybe for the others. If I identify a cat that is showing abnormal repetitive behaviors, then we might be thinking about physical health workup initially. And if we don't find anything there, we might be thinking about, coming in with some psychopharmacology for those guys as well. And, maybe identifying the one or other fringe cat that might need some physical health workup immediately, quite quickly, to help them as well. So as you can see, a complex situation, but I thought I'd chat about it today because it's been on my mind. Obviously, I've been preparing for this case for the last couple of days. We are driving up to Dubai. So, and I'm taking Nora with me. She is going to be my eyes on the ground. It is so useful to have an extra pair of eyes, somebody who's amazing at cat behavior, who can just observe things as I am chatting with the caregiver. And it's always incredible to me the things that Nora sees and picks up on that I perhaps don't, because I'm very focused on sort of the conversation with the client and helping them to understand what our approach is going to be and what we're looking for. So having that second pair of eyes is really useful, especially in a big case like that or like this. And Nora also is really, really great at chatting through resources. So whilst I'm kind of thinking about psychopharmaceuticals, Nora can take over from me a little bit and do some of the groundwork in terms of looking at, litter box optimization and some of the other resources that we think are going to be helpful, looking at the home and how we might be able to optimize space within the home. So having that second person is great. And also Nora will often take videos, obviously with the consent of the client, but she'll take videos of some of the cats just so that we have a record to go on. So yeah, having that second person is massively, massively important. And on the drive up to Dubai, which is going to take us probably about an hour, just over an hour, we are going to just brainstorm our game plan and go over the questionnaire again, make sure we've got all the details down before we actually get to the home. So that we can kind of hit the ground running as we get there. So yeah, just thought I would chat through this because I think this is such an interesting topic. And even if you're seeing a multi-cat household case with just 2 cats, remember those individual differences and looking at each cat as an individual. It can sometimes be so interesting. Sometimes we have a combination of an older, has been in the home for a while cat that might be struggling with some physical ailments, maybe osteoarthritis as they get older, and then a very young, boisterous cat that's come in. And we really need to see each cat as an individual and address their individual challenges rather than thinking about just sort of treating both as one, and then also choosing treatment strategies that are kind of the same, choosing the same medication for both. That's not always indicated or warranted. Sometimes it is, sometimes it absolutely is, but other times it isn't. So being really, really mindful of that. So even if you have a client that has a 2-cat home, a 3-cat home, a 4-cat home that is showing challenges, then, looking at things in this way. And even with the cats, let's say you've got a 4-cat home, 2 cats are actively involved, perhaps in tension or fights. The other 2 cats are still going to be affected. Imagine living in a home where there is constant underlying tension and discord and, disagreement and stress and challenge for resources. Imagine how that might feel living in a human household like that for us as humans. Well, cats are going to respond in exactly the same way. Okay, I'm going to drop in the show notes the link to my Learn to Speak Cat course, because I think a lot of what I've spoken about here is really nicely addressed in the Learn to Speak Cat course. It's a true foundational feline behavior course. It has 6 modules, and it goes through everything from emotional states to social behavior, what is play, what is no longer play, a little bit of learning and training, right through to products for behavioral health, strategies for behavioral health. So lots and lots in there. It's a great, great course if you are maybe just starting out in feline behavior. Maybe if you're a veterinary nurse or a student veterinary nurse that's interested in veterinary behavior medicine and that wants to get a little bit more involved in that. Or if you're a vet and you're not entirely sure that you have the full handle on cat behavior. We talk a lot about cat sociability, cat-human sociability, which is really quite different to the other domestic species that we live with. So it's a great, great course that you can absolutely get a lot of benefit from. So I'm going to drop the link to that in the show notes. And as ever, we've got our client handouts ebook. There's loads in there on feline behavior. So there's a handout on the 5 pillars. There's a handout on feeding cats, the optimal way to feed cats. So there are quite a lot of feline resources in there as well. So I will drop the link to the client handouts ebook in the show notes as well. And they might be things that you might find useful. All right. Thank you so much for joining me this week. And I look forward to seeing you next week for episode 107. Bye for now.